Hello, and welcome back to Brain Matters, a channel devoted to educating and empowering individuals affected by neurologic and psychiatric conditions. I'm your host, Dr. Alexis Chappell, clinical psychologist and fellowship-trained neuropsychologist. In today's video, we're going to break down what a neuropsychologist is and what the study of neuropsychology is all about. Simply put, a clinical psychologist is a doctoral level trained clinical psychologist who has received residency training in neuropsychology. In my practice of clinical neuropsychology, we use all of the advances that have been gained from neuroscience and we apply it to a patient's symptoms to better understand what's happening, whether those symptoms involve cognitive functioning like memory loss or attention deficit, vestibular symptoms like dizziness or problems with balance, psychological problems, mood disturbance, anxiety, difficulties with chronic pain, or even a person's inability to meet their day-to-day responsibilities and tasks. So, as you might imagine, I'm very fortunate to work with a large number of patients. In fact, patients affected by any number of central nervous system conditions might come and see me. For example, patients who are bravely facing their recovery from stroke, concussion, brain injury, patients who have a known or a suspected dementia, patients who have developmental concerns such as ADHD, autism, or even intellectual limitations. Also, patients who have cancer or have been treated for cancer and are concerned about the way that the chemotherapy or radiation may have affected them. Now, when these patients come into my office, regardless of the diagnosis, our goal is to employ the use of specialized tests to measure that individual's cognitive abilities, their intelligence, their personality, their ability to carry out day-to-day functions. And we integrate the findings from those testing procedures with what we know from other workups that might have been done, including MRIs and CTs of a patient's brain, testing like cerebral spinal fluid studies like a person might have if they've had a lumbar puncture, otherwise known as a spinal tap, what we might know from lab work or other cardiovascular testing, what we might know from a sleep study or even from an EEG. And our goal is to integrate all of those findings in an effort to develop an opinion about diagnosis and, even more important, an opinion about treatment planning. Now, what I've noticed in my clinical practice is that there's a big gap between what is feasible in the traditional healthcare landscape and what patients need in the way of ongoing education and support. And that's where Brain Matters comes in. I developed Brain Matters in an effort to provide education and empowerment so that you or someone you care about can obtain a proper diagnosis, can know how to ask the right questions and align with the treatment team, and of course, how to take charge of your own treatment to maximize treatment gains, to minimize symptom severity and functional impairment, and to optimize your wellness goals. I'm so glad you've tuned in. I hope you'll join us in the upcoming weeks as we take a deep dive into a number of conditions that affect the human brain. Because as always at Brain Matters, we believe when you know your brain, you change your life.